COVID pandemic has had a major impact on our lives in so many ways.
A lot of us are facing challenges that might seem overwhelming, stressful, and this can cause some pretty strong emotions in adults, but especially in children. So joining us now is child and adolescent therapist Katie Chadwell. Thank you so much for being here.
Yeah, thanks for having me.
So Katie, what are some long-term effects that you're seeing the pandemic have on children and young adults?
So a lot of what we're seeing is more feelings of unsafety and insecurity because we don't know what's going to happen next. You know, schools are open, schools are closed, there's mask mandates, then there's not. So with all of this insecurity and unsafety, we're seeing more depression, more anxiety, and just a real increased struggle to regulate feelings and behaviors. Also, you know, a lot of kids were homeschooled last year for, you know, to stay away from COVID and stay safe. So a lot of what we're seeing too is that kids are struggling more socially with interactions with their peers because they have been isolated for so long. And you're just thinking about time, you know, adults and children experience time very differently. So some kids are experiencing this as their entire junior high experience, their entire high school experience. And, you know, the younger you get with kids, like 3 and 4-year-olds, this is all that they know. And so we see, you know, like that anxiety, that depression, that struggle with regulation, and even more social struggles.
And are there any warning signs parents should look out for before this, you know, gets really bad?
Yeah, absolutely. So grades dropping is one of the first ones that we usually see. Changes in grooming and hygiene. So if, you know, a kid that usually gets dressed up for school is suddenly not showering, maybe wearing sweatpants to school, kids isolating, any kind of change in affect. One that we're seeing a lot right now is kids getting into fights that usually don't get into fights at school. You know, increased in defiance, and then any drastic changes in behavior, sleeping, or eating can all be real signs that something could be wrong.
Of course, kids trust their parents immensely to steer them in the right direction and for trust. And we've talked a lot about the possibility of a vaccine now for kids. So how can parents talk to their kids about what might be happening to them here shortly?
Sure. So I think just approaching it with an open mind is really important. And listening to kids' concerns, listening to their fears, and being able to validate those concerns and fears for kids instead of just trying to pretend like they don't exist. And, you know, this vaccine conversation actually gives us such an amazing opportunity to really dig deeper and figure out what kids' concerns are about the pandemic, what their fears are. And so really taking that opportunity to figure out what they're thinking, what they're feeling, you know, validating that for them, and then, you know, maybe creating a pros and cons list, helping them do some research if they're old enough to understand. And then also just, you know, families doing what's right, doing what they feel like aligns with their family values, and helping kids understand that as well.
Awesome advice. All right, Katie, thank you so much for speaking with us today.
Yeah, great interview.
Absolutely.
We appreciate you. Yep.
Thanks for having me.